Now we move to the United States. This is the worst event that this country will face. That is the warning from the head of the White House Coronavirus Task Force as virus cases and deaths continue to break records in the U.S. The country saw 1 million new cases in just 5 days last week, compared to the 100 days it took to reach 1 million cases when the virus first emerged in January. As U.S. hospitals buckle under the pressure of over 100,000 COVID-19 patients. The Food and Drug Administration will meet this week to consider emergency use authorization for Pfizer coronavirus vaccine candidates. This was Dr. Deborah Birx on NBC's Meet the Press this Sunday.
This is not just the worst public health event. This is the worst event that this country will face, not just from a public health side. Yet, we know what behaviors spread the virus, and we know how to change those behaviors to stop spreading the virus. When I go out, I just don't meet with healthcare providers and governors and mayors, but I also meet with community. And so I hear community members parroting back those situations, parroting back that masks don't work, parroting back that we should work towards herd immunity, parroting back that gatherings don't result in super spreading events. And I think our job is to constantly say those are myths, they are wrong, and you can see the evidence base. And right now, across the Sun Belt, we have governors and mayors who have cases equivalent to what they had in the summertime, yet aren't putting in the same policies and mitigations that they put in the summer that they know changed the course of this pandemic across the South.
All right, huge concern about what's happening in the U.S. right now. For more, we speak to SABC News correspondent Sherwin Bryce-Pease. He joins us live from New York. Sherwin, so the FDA meeting this week to consider emergency approval for the Pfizer vaccine. So the USA sort of going the UK route, trying to do this as quickly as possible.
Absolutely, and some criticism certainly in certain quarters here that they hadn't moved perhaps as quickly as the United Kingdom did, given the huge investment that the United States had put into some of the vaccine development. But that notwithstanding, Francis, I think it's important for people to understand that even with the vaccine approved, there will only be some 40 million doses available if both Pfizer and Moderna win approval in the days and weeks ahead. And that means essentially you're going to have around 40 million doses, which means only 20 million people will be able to have access to that in the initial immunization phase, because 2 doses for essentially 1 immunization over a 3-week period. So just in terms of the logistics, I mean, we can talk about that in a second. It's really just a big concern in this country. You've seen the biggest state like California, for example, a state with a population of 40 million people, Francis, going back to shutdowns in various regions across the state. This was Governor Gavin Newsom speaking to that a few days ago.
The bottom line is, if we don't act now, our hospital system will be overwhelmed. If we don't act now, we'll continue to see a death rate climb, more lives lost. And that's why today we are, pursuant to the blueprint we put out some 14 or so weeks ago, pulling that emergency brake. We've done it sequentially over the course of the last number of weeks, but we're doing it in a much more broad and much more comprehensive way today. We're announcing and introducing a regional stay-at-home order in the state of California, fundamentally predicated on the need to stop gathering with people outside of your household, to do what you can to keep most of your activities outside, and of course, always most important non-pharmaceutical intervention, that is wear face coverings, wear a mask.
Wearing a mask, social distancing, washing your hands, those are still the most important things to mitigate against the spread of this virus. The vaccine is not going to have an impact. We are told by people like Dr. Anthony Fauci that we have yet to see, Francis, the Thanksgiving surge. Remember, we talked about the millions of people against public health advice that traveled to go and see their families over the Thanksgiving break about 10 days ago. We have yet to see the surge from that those social gatherings. So we are in for a couple of months here, particularly the middle of January, post the Christmas break, when we are going to continue to see a surge here, despite the vaccine being approved this week.
Yeah, and even once the vaccine is approved, you spoke about the logistics of getting it onto the ground where like you say, it won't have much impact for a long time yet.
Absolutely not. You know, when you talk about an effective vaccine, that's phase one of what essentially is a broad-based vaccination program. Public health officials will constantly tell you that to arrest a pandemic requires not a good vaccine, but a good vaccine program. So we need to start thinking about, the logistics, the travel that will have to accommodate the temperature at which these vaccines need to be transported. Pfizer, for example, needs to be stored at minus 70 degrees Celsius or below. The Moderna vaccine at minus 20 degrees Celsius. So in terms of the transportation, particularly to rural areas, the locations where these vaccines are going to be stored, what sort of capacity do rural hospitals have? What buy-in do you have from companies like FedEx and DHL and the airlines? In fact, listen to Roger Samways of American Airlines. He's the VP for commercial cargo, talking about some of the storage capacity that they've had to accommodate.
This is designed to maintain a temperature between 2 and 8 degrees Celsius throughout the shipment's journey. It's basically a giant fridge, think of it that way. It runs on batteries, so whilst it's in transit, it's able to regulate that temperature. What's really important with these containers is you have the capability to be able to plug them in when they're not actually in transit, so when they're sitting in a warehouse. We've got capability here to plug in 50 containers at any one time.
So very, very important. We saw a statement last week, Friday, from the South African Department of Health talking about the resources that would need to be found in terms of the distribution of the vaccine. So the science is the first step, Francis, and then, of course, the distribution will be second, and that too comes with a cost and a great deal of planning that's required.
Yeah, and an expert earlier said we've basically missed the Pfizer bus because we just don't have those facilities to keep them in those cold temperatures. Sherwin, other news emerging yesterday that the President's personal attorney and former New York Mayor Rudy Giuliani testing positive for COVID-19. He's in hospital. Do we know anything more about how he got infected and his condition?
We don't have those details, Francis, but I mean, this is just another nail in the White House coffin in terms of their lack of social distancing, their lack of the appreciation for the role that masks play. You saw the president over the weekend in Georgia campaigning for the 2 Senate runoffs. Essentially, this is about control for Republicans and Democrats of the United States Senate. A crowd again packed in, most of them not wearing masks, as his personal attorney that essentially has been the face of all the court cases you've seen in terms of the president wanting to change the outcome of the presidential election. Rudy Giuliani, often seen hugging people, shaking hands, talking at various events without a mask. And this is just a confirmation that those 3 things, washing your hands, wearing masks and social distancing, work. And when you don't do it, this is the effect. We don't know the latest about his condition. What happened is the president tweeted yesterday that he had contracted COVID-19, and very shortly after we learned that he was immediately admitted to hospital. So normally, once you contract coronavirus, you need an incubation period, about 7 to 10 days. That hasn't happened. He went straight into hospital. So it's very concerning as to what his condition might be. It might just be over an abundance of caution, but normally people don't go straight into the hospital once they're diagnosed with COVID-19.
All right, you'll follow that for us. Thanks for the update. Chat to you soon. SABC News correspondent Sherwin Bryce-Pease.